Gershu, thanks for coming to Abraaj Week. When you took over Siloam Hospitals in Indonesia, it was 4 hospitals. Now as chairman, you have over 20, with an ambition to go to 50. What are the key learnings in building a group like that, and particularly what can we bring into other growth markets from your experience?
Good morning, Khawar. I think over the last decade, the biggest challenge, particularly in a market like Indonesia, and also the learnings, has been the key area of getting 4 sectors together, converging. What I mean by that is getting the private sector, the government, the NGO, and the most often forgotten voluntary network of social workers that are out there in the community. So getting them together to create a system that provides care across the continuum has been the greatest learning I've got, I think. From taking it from 4 hospitals to 22 hospitals and establishing the foundation to take it to 50 hospitals over the next 5 years. And also getting it to different tier cities, not just concentrating on metro or tier 1 cities, but creating an ecosystem across different tiers in different cities.
Excellent. As you know, our strategy is firmly embedded on bringing all 4 sectors together. You've particularly developed bottom of the pyramid, government tariff type systems for the poor and been able to make them profitable. How have you been able to do that?
Yeah, I think it's a combination of factors. As we discussed a number of occasions, Khawar, you cannot do it in isolation. I don't think, particularly in our markets, in a growing economy of nearly 3 billion people where healthcare is really lax, I don't think it's possible for any one of them to do it independently. So the way we did it is bringing in a system of salaried doctors, a model where the doctors build an institution, co-linking it and co-locating it to the middle and upper middle infrastructure so that they coexist. Gatekeeping, which is what everybody calls as managing people, the entry of the patients, and then appropriately putting them in the right channel in terms of appropriate doctor, appropriate setting, appropriate care. And then finally, clinical guidelines in terms of making sure that the appropriate investigations or diagnosis is done for those patients based on their clinical need. Bringing those elements together has helped us to not only leverage off the downtime of the infrastructure that we've invested, but to optimize capacity by delivering care for the bottom of the pyramid at the price point that the government has paid and making 11 to 15% margin on it.
Last, now you're in Myanmar and you're growing a hospital group there. What do you see the role of the private sector in places like Myanmar where very little healthcare exists?
Yeah. I mean, you hit the nail on the head. I mean, they spend hardly $30 per head on the total spend on healthcare. And I think the biggest challenge is for the government to rise up to the needs of the demand side. 55 million people, very low accessibility, very low equity. And again, as I said, the government cannot do it alone. And here is where I believe the private side has not only got a social obligation, while they make the economic side, they also got a social obligation to get into that environment, work with the government, work with the NGOs, and work with the community to really deliver care. And the private sector is pivotal, largely because the private sector drives things efficiently, there's less bureaucracy, less corruption, and a faster acceleration of development and growth.
That's fantastic learnings from your experience, Gershu. Thank you very much again for coming to Abraaj Week.
Thank you very much.